Well, for half a year now, our lives have been quarantined and masks and remote learning, and we've all been asking when things are going to go back to normal.
Well, for many, the idea of normalcy hinges on a COVID-19 vaccine, and some are worried that once one exists, states and countries will force people to get it.
Well, Denver 7's Megan Lopez tonight goes 360 on the idea of mandating vaccines.
In research labs around the world, a race against time. Every hour, an opportunity for scientific breakthrough. Every day, a higher death toll, a reminder of what's at stake. In this relay against a once-in-a-lifetime pandemic, every minute counts. But once a vaccine is created, once it's approved and widespread, should people be required to get it? In this Denver 7 360, you'll hear from a law professor, a researcher working on a COVID-19 vaccine, a state legislator who's trying to boost Colorado's immunization rates, the governor, and two people who are skeptical of the idea of mandating vaccines. From a strictly legal perspective,
a state or locality has the right to mandate.
That stems back to a 1905 Supreme Court case called Jacobson versus Massachusetts. After a smallpox outbreak, the city of Cambridge mandated vaccines. Pastor Henning Jacobson refused and was fined $5. The Supreme Court ruled it was legal so long as
the vaccine is necessary to deal with an important public health issue.
More recently, New York mandated an MMR vaccine last year after a measles outbreak and fined anyone who refused $1,000. It was challenged in court and upheld once again.
In terms of a state and local vaccine mandate, the Supreme Court precedent is very clear.
But DU law professor Govind Pershad says it's not just governments.
Employers definitely can do that. For employers, they're going to be subject to laws like the ADA, the Americans with Disabilities Act.
The same goes for customers. Businesses could choose to require proof of a COVID-19 vaccine so long as they make accommodations for customers who can't get it. And he believes some mandates are good.
By accepting, say, one regulation, a mandate, can we get rid of other regulations like business closures, like school closures that are restricting people's personal freedom more seriously?
And I don't think the vaccine is going to solve the societal problems. My name is Robert F. Kennedy Jr., and I'm the attorney and president for the Children's Health Defense.
With every vaccine, there are potential downsides.
The federal government has paid out $1 billion in injuries from the flu vaccine.
Robert F. Kennedy Jr. is worried about rushing a COVID-19 vaccine.
Maybe they will come up with a miracle vaccine. If they do, I'll be the first one to take it.
He says researchers have been working on a SARS vaccine for years and haven't gotten it right yet.
I don't think they're ever going to come up with anything that is even close to that.
So he's concerned about all of the hope being put into a vaccine and the fast-tracking process.
Well, I think it's a healthy thing to question the pharmaceutical industry.
These are all things that were essentially written about in science fiction novels. Now we are seeing them in action. So
Del Bigtree is more concerned with potential mandates. He believes it should be an individual choice.
I don't think that the overall health is really the position of the United States government.
Even if states don't mandate it, he's worried people who refuse could be ostracized.
There will be a lot of pressure put on private businesses to have their own internal mandate.
But Del says he's going to fight for the right to choose.
We will be doing everything we can to fight for people's freedom and right to decide what's injected into them. We are not farm animals. We are free citizens.
If there's anyone who knows about vaccine pushback, it's Representative Kyle Mullica.
It still was a struggle, and it was still very contentious.
He helped pass a bill this year to require additional steps for families who don't want to immunize their kids and took a lot of backlash for it. He says in order for a COVID-19 vaccine to work,
we have to have a certain percentage of our population immunized for vaccines to work.
But Mullica insists no one is talking about a mandate in Colorado.
No one is looking at going to your house, tying you down and forcibly injecting you. That's not something I advocate for. What we can do is we can look at what tools are in the tool belt.
For Governor Jared Polis,
how do you prioritize?
It's not a question of how to make sure everyone is vaccinated.
There will be limited dosage available of a vaccine as it comes online.
Right now, the priority is making sure the right people are vaccinated.
How can we make sure that we have the highest and best use of the limited supply that will be available in our state is the real question that we're beginning to grapple with.
He's working with health experts to figure out who comes first.
We're going to do our best with our strategy.
Inside this laboratory on the CSU campus, the clock is ticking.
Progress is moving along on our 4 vaccine candidates.
Dr. Gregory Dean, one of many working on a COVID-19 vaccine.
These are times like no other that any of us have seen, so it takes extraordinary measures.
He understands the concerns about a new vaccine, but insists even with the faster pace, the process is the same. And during a pandemic, time is something he says researchers simply don't have. But
mandating vaccines, I struggle with that. I think it's a distraction. I feel like that can co-opt the conversation.
He believes it comes down to better communication.
This is a time for us to build the communication relationship and trust between scientists and the public. We're communicating the message of why should people do this.
At research labs around the world, a race to find a vaccine that could bring back a semblance of normal. But when the time comes, when this vaccine comes, will you take it? With this Denver 7 360, I'm Megan Lopez.
So what do you think about mandated vaccines? Email us your thoughts at 360@thedenverchannel.com.